This conference will now be recorded.
It sounds like it is. Hi, everybody. My name is Nikki Rayman, and I'm with Intelligent, but we're going to talk about, Sherry's going to come on. I'm going to introduce her, and her voice is going to be over what you can hear. Hi, thank you for coming. We're going to talk about quality improvement methodology and QAPI. You've probably heard those terms before. And we're going to talk about how it is useful. How can we apply it in a pandemic right now? So we're prepared for anything else, right? Hopefully so. Let's see.
This conference will now be recorded.
Well, it's always good when Z and I check it out. Hi.
Sometimes you just click the screen.
You mean the
On the
mouse?
PowerPoint. Yeah, on the mouse, just click the PowerPoint screen.
There it is. Well, now that advanced, this didn't advance. Okay. Yeah. Hang on, guys. We're going to get it. You know, we're going to run a PD essay cycle here. Never heard that? You're going to hear it today. Are you familiar with that? Plan, do, study. Something doesn't work, cross out that intervention, you're going to look for another intervention, and that's what we're doing right now. So, yes, it does. Thank you. All right, so whatever Z did is the intervention we need to do in the future. I'm Nikki Rayman.
Are you recording?
I don't know. Let's see here. There's a red button on.
Yep, you are.
Okay, all right. We're recording, I'm live. Thank you all for being here too, there at home or wherever you are. I'm welcome, thank you for being in. And I am working with Intelligent. I've been a nurse for about 4 years, worked in a variety of settings, started out in a nursing home setting where we gave a lot of Thorazine and Mellaril a long time ago. We don't do that much anymore. We used a lot of Posey belts. We didn't do that. We don't do that anymore. So I'm a quality improvement facilitator, and I work mainly with the nursing homes. Sherry's going to talk about the QIO, Quality Improvement Organization. Am I in your way? Talk to her. And what we do here at Intelligent. So Sherry, can you introduce Sherry? She's a colleague and a friend. And all right, Sherry, take it away.
Hi, everyone. My name is Sherry Longacre, and I am a Senior Quality Improvement Facilitator here at Intelligent, as well with Nikki, and thank goodness we get to be partners in crime together. So I have been a nurse as well for quite some years, and have had the pleasure to work with long-term care with Nikki in quality improvement. With our nursing homes throughout the state of Oklahoma, and we enjoy working together and also see all the positive results that we see along the way. Nikki, are you going to go through the disclaimers?
So here's another thing too. So I want to just be sure and point out to the disclaimers here. We want to let you know that any information that we give today is as current as it is at this moment. All right, and so just to let you know that the Intelligence is not responsible if CDC changes something on us in the next hour or so. Just go back and be sure and check that website. And also let you know here that the material that we prepared for Intelligent is not necessarily verbatim from CMS. It's our presentation and understanding of what they are, but we've got those resources and rules set for you so that you can go online and search yourself for those exact definitions. So we've got those resources.
Perfect. Thank you so much, Nikki. And as I kind of introduced myself earlier, but first of all, before we get started, I want to thank you guys for everything you do every day for our residents. And because there is just so much going on right now in long-term care. And Nikki and I are excited to partner with you and to be here with you today. So next slide. So just in case some of you are not aware of who Telegen is, we just want to share some of our big news is that in November of 2019, CMS awarded a 5-year contract to Telegen to serve as the QIO, who is the Quality Improvement Organization, to serve as the QIO for Colorado, Illinois, Iowa, and Oklahoma. So we are excited to share that here with you today, and we'll also give you just a little additional information on that as well. Next slide. So a little bit of information about the QIO's purpose is to improve the efficiency, effectiveness, economy, and quality of services delivered to Medicare beneficiaries. And for over 45 years, Telegen has brought together healthcare professionals across all settings and programs to support their quality improvement efforts that benefit Medicare beneficiaries. And for the past 16 years, you might be a little more familiar is that Telegen has worked with the Care program. So transitioning into the state with the QIO work was just a natural transition for Telegen. So what we're here in kind of talking to you just a little bit about it also is that as the QIO, we're offering an opportunity for all of our healthcare partners across the state of Oklahoma to join us in our exclusive regional healthcare quality improvement collaborative, which we affectionately call the Telegen QI Connect. And as we go along, you'll find that our focus aligns with your vision and also puts your residents at the forefront along with your direct care workers. What we do is for everyone at the facilities, not just the leadership team. And as we kind of, I think you might have seen in the slide before that, is that there is absolutely no cost to join and to partner with your QIO. It's a federal contract. It's paid up front through the Social Security Act. So there is no charge for absolutely anything that we do. Next slide. So kind of explaining how we are going through and launching our learning collaborative is through the Telegen QI Connect. And we prioritize our work around 3 main priority areas that have been identified by CMS. And that is supporting vulnerable populations and reducing healthcare disparities, supporting rural communities, and also increasing person and family engagement. And CMS has focused the work into 5 strategic aims, which are goals that you can see in these little multiple colors on the slide, which are to improve behavioral health outcomes and increase patient safety, increase chronic disease self-management, increase quality of care transitions, and also improve our nursing home quality. Next slide. And through Telegen Connect, we will have affinity groups and learning collaboratives that align with the CMS strategic goals. Now, the affinity groups are under each one of the categories, but underneath that, especially under nursing home quality learning collaboratives, you can kind of see what we're focusing on, which is 5-star improvement, infection prevention, top of the list right now with our COVID-19 resources, UTIs, CDIs, also decreasing those emergency department visits and rehospitalizations, and also including in, which many of us have worked on over the years, is decreasing those antipsychotic medications and opioids as well. Next slide. The Institute for Healthcare Improvement, which is IHI's Breakthrough Series model, is the core learning collaborative approach to learning and innovation intelligence for affinity groups. This is evidence-based and a proven model to work effectively in all settings to make lasting success. And as we go through, we will offer some of our learning activities using the Learning and Action Network events, which you will have, sometimes folks call them LANs, And these sometimes can be single events if we have a speaker, or they could be a mini series utilizing the ECHO model where we have multiple groups. Next slide. This is an example of how Telligent will structure the learning collaboratives based upon the IHI's breakthrough model. And if you are familiar with your QAPI, then you will also be familiar that we utilize the Model for Improvement, which is the Plan, Do, Study, Act. And this is how we will be able to lead our improvement as we work through our learning collaboratives. You can kind of see that this gives you an example of how we will do our virtual learning sessions, where we will launch our learning collaborative, continue on with our pre-work, and then after each learning session, we will have an action period where you will implement whether your Plan, Do, Study, Act. And at the end, we will come together and have an outcomes congress where we are sharing successes. And sometimes in that is sharing more so all the successes, but the lessons learned and what didn't work. So we're not duplicating things that didn't work, for sure. Next slide. So if you are familiar with Telligent, then you probably know that we love data, and we can't measure improvement without data. So data will be collected during some of these Infinity groups. Of course, this is voluntary when you are collecting your data and sharing your data. Once you do collaborate and join with Telligent QI Connect, then you will have an online portal. So all of the data that you share with us is secure in that online portal also. And this data that we are collecting is aggregate data, so it's not, focused on resident care data or anything like that. And this data is something really everyone should be measuring already for performance pay, and affects your overall quality star rating. So this is also aligning with what you're already working on in your facilities. Next slide. And Telligent commits to providing those who participate with quality improvement expertise and tools that are relevant, beneficial, timely, and effective. And we will be able to assist in analyzing data, helping you to discover opportunities for improvement, and provide technical assistance during learning collaborative action areas. Also, Mickey and I many times sit down with our nursing homes and review data to assist them with their QAPI. So if they are having problems or need that external eye, I should say, we are more than happy to do that, because sometimes that's what it takes, just sitting down, reviewing those CASPER reports, and understanding where we can make those improvements and the interventions that are best for our nursing home residents. Of course, what to expect from us is we do share data. You have lots of access to peer-to-peer sharing, which is where we learn so many innovative ideas, is learning what is working with other folks. And of course, there is absolutely no cost to participate with us. Next slide. I do want to just kind of share, when you're in the portal, on your online portal, this is kind of some of the data that you would have access to. This data is just simply showing, we put this together because we were curious. For one, we were just wanting to see, what did the quality measures look like before COVID? So we did data prior to December 2019, and then after, with 2019 to May 2020. So we just compared the two, just to kind of see where we lie with our quality measures. Next slide. And then here is an example of the data that you will be able to have access to in the online secure portal to track and trend your own individual data charts for internal quality improvement projects. if you are part of a corporate group, or you're an administrator over several nursing homes, or then you would be able to be linked to those additional nursing homes, and then you can track and trend data in the other corporate group as well. Next slide. So this is just kind of a few of the tools that we have available and that we are assisting when we're working with the nursing homes on infection prevention and control. And, that we've identified working with our nursing homes over the past few months, in that some of these are that we've identified, the tools that we've identified have been that fillable assessments, so that you're not having to print them off and having to complete the assessment and then having to scan them back to someone. So fillable that you can save and then you can review later on. So those infection prevention and control assessments in the fillable format have just come in handy for many. So that's one of the things that we identified right away and we put into place. We also have, through identifying and reviewing that infection prevention and control assessment, we have identified that a few of the tools that were lacking were the audit forms with feedback, and that was on our hand hygiene and PPE, which we always say kind of go together like peas and carrots. So we have provided those audit forms also, so that you can calculate those compliance rates, which is so important. And some folks were completing information, so they had access to all this data, but they weren't for sure what to do with it. So that is what we're here for, is to kind of help you put all that together. Now, currently, these tools are available to all of our nursing homes and throughout all 4 states. However, once enrollment ends, and this is the first time that CMS has added a caveat that enrollment in partnering with the QIO will end in early November. So if you have not been partnered with Telegen and have not registered and joined Telegen QI Connect, then you will have access to what's on the website. You will not have access to the one-on-one technical assistance and then the other tools that we have available. So just to let you know, that's kind of a new caveat that CMS has put into place this year. Next slide. So I kind of shared information about the QIO and how Telegen will support our nursing homes and communities and improvement processes. And then we do all of this through Telegen QI Connect. And that is how we are able to share information, also how we share our learning collaboratives, upcoming events, and just keep us all connected together, as well as all those vital tools and resources that we share. So we are asking all of our nursing homes to register and sign up so they do not miss out on this exclusive no-cost opportunity and are able to have the QIO support when they need it most. And some nursing homes we have talked to, they're, I don't know how to say this exactly, but you just don't know when that assistance might be needed. It may not be today, but it may be over the next 4 years. So we just want to make sure that we're able to partner with you now in case that help is needed and assistance is needed later as well. So it only takes literally 1 minute to complete this, and that's why I put this in here, because I just want you to see this is really all they're asking: your name, your email, your organization, and then what groups that you would like to join. And that would be probably the most interest would be the nursing home, and then also care transitions, which is something that we're all so interested in as well. And then next slide. Also, I put my contact information on here because we know that everyone has got so many things on their plate right now, and that COVID has increased so many activities and testing, and there's just an overload of things going on in the nursing home. But we have made registration even easier. You can shoot me an email. You can also send Nikki one as well. We have a spreadsheet that if you're signing up multiple facilities, we have an Excel spreadsheet to make life even easier for you. And if you just fill this out or send us an email, we can complete the registration for you. Next slide. So we talked about the previous slides in that are related to the Intelligence CMS initiatives, and this is identified as task 1 and task 2. So I want to share just a little bit of information about our task 3 that we are our work that we also work on, and that is the quality improvement initiatives, our QIIs, that Mickey and I work with a lot of our nursing homes on. And this is part of a modification of our contract. There are 2 types of support that we provide in the QII initiative. And what I really want to elaborate a little bit more on is the second type of support that we started over a few months ago. And this is on the task 3 quality improvement initiatives, where we are working with our nursing homes from referrals from CMS. They are time sensitive, and so we do have to reach out to the nursing homes within 5 days of receiving these referrals. These referrals can be based upon NHSN data, if you had an outbreak of COVID-19 in your nursing home, or if you have had any F880 tags in the past 12 to 15 months, that can trigger as well. Next slide. And this slide just gives you kind of a visual of the timeline of how will you support the nursing homes through the CMS targeted referrals QII work plan and work. We model it from the Model for Improvement, the Plan, Do, Study, Act. So the first month you are in the planning stage with your quality improvement facilitator, and that is where we are putting the plan together. And then in month 2 is where we have launched our learning collaboratives. And the learning collaboratives, if you do get to attend sometime, you'll be very familiar because Mickey teaches this class. And it is a rapid cycle intervention 4-week cycle PDSA. So Mickey does a fabulous job and working through that. And then month 3 through 6 is where we are checking in and just giving additional resources if needed, and monitoring data and just really supporting the nursing homes. So next slide. So what we do know, and kind of, I know that I gave a lot of information quickly, is that it takes a village to build a better, smarter, and healthier healthcare delivery system. And we also know that you share our passion about ensuring that you have the expertise, tools, and resources that you need to achieve not only organizational healthcare goals, but also what we work as a community to make care safer for the benefit of our residents, our team members, our families, friends, and neighbors. And so I wanted to share on this just a few of the things, educational opportunities that we have going on for our Oklahoma nursing homes. And that one of the reasons is I couldn't be there today with Mickey is that we have a QAPI push sprint class starting today, and it is a 6-week class. 1 hour a week. Of course, it's virtual since it's this new world we live in. And so we are excited to get that started. We had a pilot that we completed last month, and it was a success. And so we have limited it to 30 nursing homes participating, and then now we have an additional 30 in this class. So we're very excited about that. Also, we have identified that as survey is coming out and those F880 tags are coming in, that weekly root cause analysis classes were needed. And so we have weekly root cause analysis classes every Tuesday morning at 10:30, and you can pop in if you need that additional training, or if you just want to pop in and receive that training. It is open to everyone. And if you have been connected to nursing homes, you understand that what a huge, heavy lift it has been in order to enroll and submit the data into NHSN. We do provide NHSN support, and we had meetings at 8 a.m., at noon, and at 5 p.m. all week long, 1 week, just to assist nursing homes in being able to connect and get registered with NHSN. Now, NHSN has just now, they are starting to change the level of access that nursing homes are required to have. So they're changing it. So you may, if you are connected with the folks that are submitting data into NHSN, just make sure that they are aware of that and that their access will be changing. We are providing assistance with that. They'll be receiving an invitation in their email in order to change access. And always, I always want to share is just make sure that you have more than one person who has access to NHSN data. The financial penalties to not submitting your data in time is significant, and it adds up quickly. And if you were needing to add another person to receive access, it takes a little bit to get that access. So always make sure you have more than one person. I always say you cannot have just one key to the castle. Everyone has to have more than one. And we also have infection prevention tools and resources. And like I said earlier, we provide one-on-one technical assistance if needed. So we try to work with our nursing homes any way we can and just try to be that trusted resource for everyone. So with that, I will see if you have any questions and turn it back over to Mickey. So if you have any questions for me, you can reach out to me. We have provided my email, and then Mickey will be sharing our contact information as well. So with that, I will hope you guys have a wonderful day. Thank you so much. And Mickey,
Sorry, I wanted to catch you before you left. So, and thank you for letting me interrupt you. So for the students who are going, participating in Administrator University, how would they sign up on QI Connect? Since they're not administrators, or they're, if they're like one person is an actual staff person. So how about somebody who's in this class who wants to go ahead and sign up and get access to the resources?
So it is open to all healthcare across the state of Oklahoma. So you do not have to be, an administrator or anyone specific in order to partner. So you can just go in there and register. And then also one thing I'd like to add is that we can always add staff later on. The most important thing is if we have the nursing home registered. And all individuals, like I said, can register solely by themselves as well. But it is important to have the nursing home registered also. And we can add multiple people later on to those individual nursing homes. But it's just so important because registration will be ending in November. I think it's November 4th.
Thank you.
Yes, absolutely. Any other questions or anything for me? If you do, just reach out to me on my, you can shoot me an email and I'll be more than happy. I always try to get back quickly. So it was a pleasure being here today. Thank you so much, Dee, for having us. And with that, I'll turn it back over to Mickey. Thank you so much, everyone. Have a great day.
Thanks, Sherry. Good luck on your class.
Thank you.
The push print that we were talking about there is for Oklahoma homes here, and there's a cap of 30 homes who can participate to get this going. But this is the second cycle, and they plan on rolling it in the future as well. So hello to Cindy, Edward, and Nola. Hi, Mickey. Let me just say a couple of things here. See this book here? We're going to cover this whole thing today, this morning. So, are you worried? Don't be worried. There's a lot of information, a lot of content here. I'm going to present it as it, well, let me just see how you all are. How familiar are you with, I know you're familiar with COVID, right? And in the sense, do you all also work in the, not yet? Okay. How about you, Edward? Not yet, okay. Cindy, you do?
Yeah, I work in an IPF, IDs.
Yes, okay, good. So that's challenging as well. Yeah. So thank you for sharing. It's been, it has changed the world, COVID has. I mean, so you don't get to walk out the door with makeup on your face anymore. You get to walk out with a mask. So that's just the way it is. So I appreciate you all for coming, for being here. And let me just say too, that I'd like to wander in Rome, and I might have, see if Z can move this podium just so I can have some space and feel like that we're not a huge group here. So I'm going to say that, first of all, can you improve quality during a pandemic? And that's what we're really focusing on. And you know that if you don't know, state surveyors are really focusing on coming into the homes and looking at infection prevention strategies. Do you have your policies, procedures? You know, the nursing homes are scrambling. And I'm going to rotate between saying nursing homes, communities, long-term care, and all these.
Ma'am, can you read?
Yeah.
Can you? We're having a hard time online hearing you. You're fading in and out.
So I wonder what would be useful. If I stand here, does that help?
Yes.
Okay, maybe I need to talk louder. So thank you
I
for
don't know.
being here.
Yeah, I don't know about louder, but I mean, but you're fading in and out when you're walking and stuff. Sorry.
Oh, okay. Sorry, that's my, yeah, okay. The other thing I want to know, do you want this, does this dim? Does the light dim where you can see the, you haven't tried it? Okay. That's all right. Okay, good. So I'm going to stand here at the podium more so just so you all can hear, and I want you all to hear. Thank you for saying that. So also the concern has been focused on PPE acquisition, getting PPE, we'll kind of get that resolved. We're month 7 of COVID. The pandemic was announced on March 11th. So here we are now, and quality can be improved even during a pandemic. So we're going to dive in here. So here's a great quote from Don Berwick. He is CMS administrator, used to be, and now he's with the IHI Institute, which is the model for healthcare improvement. So he's a guru in healthcare improvement that's been around. So not all change is improvement, but all improvement is change. All improvement is change. Did any of you all, did Z send out the slides for today for all the presenters? And did anyone look at them? Have a chance to? You did? So we've got some overachievers in here. Okay. Just like to make sure. Good. Thank you for doing that. That'll give you a head start. You'll have it as well. So the objectives for this morning, part of the objectives were to have Sherry share about QIO, QIN. She and I both worked for quality improvement organizations in the past. And so we're involved with going out and have been for years, just going on site. Now we don't go on site so much at all. So we're going to identify quality improvement methods and tools and describing the importance of teamwork, right? So we're going to spend a lot of time talking about teamwork for successful improvement. And I'm sorry if I'm standing in your way here, but also define the components of QAPI process, what that means if you don't know, and also explain how QAPI program fits into the pandemic, how we can it all fits in, everything just rolls in together. So what is QI? What is QI? So it's a model. It's a framework used to guide our practice, how we are working. We all want to improve, right? Want to improve our I don't know, maybe improve your living room, make it look more friendly, improve the flavor of your coffee or tea. You want to make improvements so that it's more enjoyable. But in this case, so that it improves the quality of life for the residents and for your staff. We want to make sure we're systematically improving those ways to get it out to the families and to residents. We also, all of the elements and the processes that are involved in quality improvement are used, have facets of them that we measure. And we'll talk about data and measuring it. You have to have a starting point. You have to have an ending point to measure how you're doing and how that all maps out, right? And so it really is to achieve the outcomes, and it's continuous. So once you achieve your goal, doesn't mean you stop. You keep going, okay, we're at 100% compliance in hand hygiene. Let's move on and put that off to the side. We had checked it off, we got 100%. Got to keep it up, right? Because you're going to have staff turnover. You're going to have people who just forget. You're going to have people in a hurry, and that's the biggest complaints that I hear from homes so far. So how does it work? We're going to find the root cause of the problem. So you're going to identify a problem. You're going to look at it and find out, and we're going to go through the 5 whys and how to tackle, dive deep and to find the root cause. Also, it's resident focused. Obviously, we're here because of our residents, right? We don't have, we're here for them. And that's where we're going to focus the whole processes for those folks, right? So it's also focused on measuring improvements and making improvements. And it helps us understand the processes that are in place. The processes include things like the root cause analysis. Some of this may be technical, but as you get involved in it, it just is a part of your workflow. It's part of your muscle memory, as we say. There's always evaluation, feedback, so you can find out what worked, what didn't work. If it didn't work, we're going to toss it aside. Like this morning, trying to get the slide advancer to work this morning. Tried an intervention, it didn't work. Z tried something else and it worked. So we did a little cycle right there. PDSA got help. And the process again is ongoing. It is just continuous. Continuous at all. Never stops. Never stops. But how do we build a QI culture? We're going to build that in your home, in your facility, right? It begins with leadership, and that's where you all come in. Right? You have a huge role, an exciting role, an innovative role to be the administrator or assistant administrator, but it's great. It's definitely defined by leadership. So if the leadership walks in and they have a great attitude, or they're like, we're going to make this improvement, and you're present meaning present when your staff come and talk to you, you're actually listening to them. You're hearing them, you're acknowledging them. That's very important. That's where we're going to start talking about teamwork here. You have to have team involvement. You have to. You need that team and that staff buy-in. Things are challenging right now. Cultures are challenging. The generations are challenging. And so you want their input. They might have just important jewels of knowledge and experience that they can bring to the table and share and develop and help you. They're also the frontline people, right? They're right there working with the residents. So they know that what Mr. Gutierrez wants is, prefers chocolate pudding, not the vanilla. That's why he's not going to he'll get angry if you give him vanilla. And so those are things that are very, very important to improve their quality of life and their resident preferences. Also, data. Your data is going to tell the story of how you're doing. You'll see if you haven't already. Also, you're going to utilize your quality improvement trainings. You want to also train your staff. Let everybody know. It's not just the leadership, the DON or the administrator or the ADON working on these projects. It's really the whole entire team. Everyone in your home should know and be working on and monitoring everyone on hand hygiene. You know, the residents even do it sometimes. They'll call the staff and say, you're not washing your hands. Also for accountability, this is, you know, own up to what you did. We don't like to say, oh man, I messed up. I mean, who wants to say that? We don't, but we have to, we're human. And when you share that something is not the way you really wanted it to work out, or there's an error or a mistake on your part, own up to it. It also shows your staff that you trust your staff enough that they're going to support you if something happened. You know, the forgiveness, to have grace on someone if they mess up. It also lets them know you're human. It lets them know your human factor. So just go ahead, open up. Your staff may do that as well. Why teamwork again? Well, clinical errors can be reduced. So when you've got a solid team, or as solid as you can get, even with ongoing, you know, turnover or whatever, people retiring or whatever happens, you can still get that team on board. And when you've got that culture of teamwork where everybody's respected, everyone from every department, then your clinical errors are going to be reduced. You're going to support each other. You're going to watch out for each other. You're not going to do finger pointing. Hey, they're wrong. It was their fault. The resident outcomes are obviously going to be improved. Right? So you got good teamwork. They're going to see everybody's working hard to improve quality of life. So it improves not only the residents' quality of life, but also the staff's quality of life. They want to stay there, right? So also increase staff and resident satisfaction and well-being, which can reduce staff turnover. Maybe they don't want to leave. Maybe they like everybody supporting each other. Don't you like to be supported, acknowledged? And then in the hustle bustle busyness, things are going to happen and you won't get a chance to reach out to everybody every day. That's just the way it is right now. But when they know that they can come and meet as a team. So just want to let you know that. So also celebrate wins. And I'm going to tell you, I'm going to share a lot of little stories here, and we're not going to run out of time. I won't let it happen, but I just want to share a story here about an administrator whose community was struggling with the deficiency in an F880 tag, and I don't recall what exactly the tag was. That's the infection. You know, something was going wrong in their processes when state survey came on site. And when they came back to reassess, the surveyors came back to reassess the plan, it didn't make it again. So the staff were all bummed out. The morale in the entire home was just awful. People were upset. There were some call-ins or call-outs, I guess is what you guys say. The staff didn't want to come to work. It's like, why? Why bother? And so the administrator saw, she said, you know what? We were also bummed out. We've got to do something to increase our morale here. And so what she did was call a huddle. Okay, a huddle, and we'll talk about huddles because they don't have to be 20 minutes. They could be a 5-minute huddle. Be a quick huddle, random spot huddle, getting them together like in football, where they call in the coach and make a new play based on how the team is doing, or pull out a player and put in a new one. You're not going to pull out a staff and put in a new one, but you are going to talk in a huddle. And she said, you all have been here every day. You all have worked hard. You are documenting, you are working hard. You're doing all this great work for our residents. You show up. And that is huge. And I just want to thank you, she says to them. I just want to thank you for what you are doing with the team and with the home. And so what that did was bring up, they saw the leadership, they saw their administrator, supporting them despite challenging time with the surveyors. So anytime you got a win, go ahead and take that win. She saw an opportunity and wanted to make a win. She wanted to make something positive out of it for her team. So if you think staff involvement is not important, then please consider the following reasons why staff involvement is important, right? So we're going to have improved resident outcomes. Your star ratings are going to improve. When the public goes on to nursing home compare, Medicare nursing home compare site, online, you're going to see your stars there. It's going to enhance your profits, really, because they're going to see that, wow, this home's got, their teamwork is solid, they work well, there's a flow, they've got a groove thing going on here, and they're really working well. And so hospitals may want to make their discharges for skilled nursing in your facility. You know, they want that. So you can get that reputation out. You all know the good homes and bad ones you've heard, right? You know, maybe. I have anyway. So that means you're going to have a higher census, higher skilled nursing. You're going to get better or more money revenue coming in for your home. Also, employee satisfaction's increased, leads to staff stability. And also, you're going to demonstrate the quality is improving, right? So you're going to see that it's improving, and it's also a CMS requirement. So I just had to throw that in there. But you're going to see all this. So let's see, we're at 9:15. We started 45 minutes ago. Let's stop for a moment because we want to make sure. Just take it, you have something to drink. Take a drink break.
This conference will now be recorded.
Sorry, it was not recorded because we stopped for a water.
That was a water break.
Yeah, we said the B word, break word. You see in his goodness, paused it. So we're gonna, here. Okay, anybody need a peppermint? If you need to stand up or stretch, or if you need to leave ever, certainly go ahead and do that. So what is a process? You're in the process right now of learning. Right? And I want to help you with that. So I don't have all the answers, by the way. If I told you that, I just want to tell you I don't have all the answers, but I can find out where they are and help you find them, and we'll work together to make sense of it if we need to. And let me tell you how much I've learned from working with communities. I've learned more from homes and the staff than I could learning about QAPI. I'm just sharing that too. So thank you all for going into this beautiful work. So process is a series of steps or actions performed to achieve a specific purpose, right? You're in the process of going to school, you want to be an administrator, you want to prep for the board, you want to pass it, etc. For QI, another way of looking at it is you're advancing, you're progressing toward improvement using steps or tools to get there. We're going to talk about models for improvement. We're going to talk about that PDSA, Plan, Do, Study, Act, and how that's going to work for you guys. So why in the world do we use processes? Well, if you want successful improvement in your communities, processes are necessary. We're going to talk about those different tools and processes. Use processes in the form of resources, tools, and models to plan your changes and interventions. You can't just like pull it out of thin air. It may be disorganized. You need some kind of structure, some kind of guidance. That's what those models. You can't repair a car. Maybe you can if you're savvy. I couldn't, without some kind of guidebook on how to take out the engine and put in the main oil with, I don't know, those kinds of things. I'm not a mechanic, but I'm a human mechanic as far as working on body systems. So process shows how well your team is doing. You're gonna, goals, you can see if you achieve your goals, and also it demonstrates your clinical outcomes. So what are your measures? We're gonna go back to using Casper and data such as, for instance, it's going to show decreasing rates of UTIs, urinary tract infections. All right, symptoms of a broken process. We hate to talk about the negative, but we've got to, because there could be communication issues that could really break down getting your teams in place and going here. So we want to be sure that, first of all, I'm going to go all the way down to the very last one that says blame the process, not the people, right? So if there's a broken process and you're just getting things going, I'll just share another example of a nursing home administrator recently who they're working on a directed plan of correction. And they had to do, I don't know if you've ever been involved with directed plan of correction, hopefully you never will be. But if you are, then there's some, learning these tools will help you get through it quickly. They had to work on a root cause analysis. It was about face shield removal and not cleaning it between resident care and setting it down on a surface, picking it back up, so just not following the CDC protocol for the face masks. And also, let me just interject here. I'm going to stop here for a minute and just tell you that if you've got questions, please be sure and ask. I hope you do that already. And so when the state came back to do their phase 2 review with the home on their face shield tag and citation deficiency, then they saw that two of the staff people did the same thing. They entered, exited, and set it down and didn't do good hygiene. And that was after they just started the week before doing extensive training with their staff about face shields and about PPE. And the administrator became upset. I mean, clearly you're working on it, you're passionate about it, you're narrow focused on what you want to do for that. And you see the staff still continuing to do it, but they didn't have all their systems in place yet for tracking, for auditing. So part of it was the process part. And I just want to share that, you've got to look back at, okay, well, where did we fail? Where did we fail with those two staff people with the mask or the face shields? What happened with that? And so that's why you want to start with the process and not point fingers if they did that wrong. Sure, they should not have done that, right? But they did. So where was the breakdown? So go back and find out where the breakdown is. This one I wanted to add to be sure. Have you ever been so busy that you didn't even stop to look at what might be blocking your progress? And then also you were not even present to notice what was going on for your staff providers, right? So always look at everything you're going on here. Why can't I move here? What's blocking it here? A flow chart, if you're not familiar with that, we're going to do a little exercise at the end of the day, or the end of this presentation today, the flow chart. So just look forward to that. So it's going to be a diagram, or it's actually a map showing you from step to step of all the processes of how to get to the goal. Okay. Step by step, just remember that. What are the benefits of flow charting? Well, first of all, you're going to see that it's going to uncover some of those things you may not have seen, like the visible becomes visible. So you're looking at all these step by steps. It helps with the process understanding, right? So first you do this, then you do this, then you do this. You have to keep it in a sequence. You don't just start grabbing a paper towel, drying your hands, and then you turn on the water to get them wet to wash. There are some sequences in washing your hand hygiene. It also shows a common team vision. It illuminates problem areas, right? So you're doing the flow chart and you're going, wait, we need to do this too, and maybe add a step. You can get sticky notes. Sticky notes are great. You can stick them on a table. You can stick them on a board, on a wall, and kind of map out ideas. So it's kind of a great way to get team involvement, to use sticky notes. I like it. It's one of my favorite things. You can use a flow chart as a training tool, share with your staff, boost some communication, some team building with your staff, and so. You may or may not be able to read that, but first of all, where are you going to start with flow charting? We're going to begin at the beginning, right? You're going to start with step 1. You're not going to start with step 5. You're going to start with step 1. First step in the process. So again, first you do this, then you do that. Consider writing each step in the process on a sticky note. That's just one way. You don't have to do that. You can, if you're tech savvy and you really love to develop graphs and things, have several copies of them and, fill them out that way. Use a verb to describe what you're going to do. So you would say, okay, start here, open this, write that. Like when I gave the objectives at the beginning, I started with the verb. You're going to describe processes of the QAPI program. Okay. And then each step, of course, should lead to the next step in a sequence. And then after that, after you have all your steps lined up there, you connect them with a line and an arrow showing the direction you want to go. This is an example, and I'm sorry for you folks at home. I want to make sure you can hear me. This is washing hands in an airplane. So we're talking about hand washing, infection prevention here, right? So if you look at the first diagram, I don't know if you can see it where you're sitting. Washing your hands at 30,000 feet, looking at these instructions. We start, you wash your hands, and you end. Well, does that tell you what exactly to do? Are they clear? Are the directions specific? Can't assume. Then look at the 10,000 foot view there. So you're going to start, you're going to wash hands by turning on the water, dispense the soap, wash hands till clean, rinse soap off, turn off water, dry hands, and end. Okay, well, that's more clear. It's clearer than 30,000 feet. But then when you get to the runway, when you're on ground level, you've got it all here, right? So you're going to start, you're going to wash your hands, turn on the water, dispense your soap, rub hands together. Then you're going to, are the hands clean? No, they're not clean. Let's say to use that arrow flow back up to rub hands together, wash hands till they're clean. Are they clean now? Yes. Rinse the soap off, turn off water, dry hands, and end. Well, is this more spelled out, more specific for you? Of course. So that's why you've got to be sure you're being real specific when you do that, when you're writing out your flow chart. All right, so that's the first model. We're going to go maybe, if you can, about 10, 15 more minutes and take a break if you want. If you need to step out, of course, I'm not going to let you, but I will let you. It's very important that we set our teams up for success here. So what is root cause analysis? I'm going to refer to it from here on out, RCA. So it's a systematic process. Using a system approach, you're going in a systematic way to identify unseen factors that contribute to undesirable outcomes. So why did this resident fall? You're going to look at, well, why? Was, there's a variety of reasons, right? So you're going to look at what's going on. You're going to assess the environment. You're going to look at everything. You're going to look at what medications. You're going to look at everything. So you're going to ask those why questions. And it's important to set teams up for success. You want your teams to feel successful, right? And it's important to guide them through the process. So as they're looking at root causes too, you're going to look at the symptoms, which are the top of the tree here, this example. Problem is the underground, the root part, and then all the causes are underground, and that's where it shows. So you want to address an undesirable outcome, meaning you don't want them to fall anymore. You don't want your residents to fall, right? So you're trying to work the problem, and we don't want your staff to feel fearful or upset as they're going through the root causes. Sometimes you feel responsible. It's like, oh my gosh, they're blaming me for this. It's not. It's like, let's look and see why they did that. Focus on what they can control related to the problem. Questions on that? Root cause analysis, RCA. You're going to see that, hear it from here on out if you haven't already. This is a 5 whys worksheet. The slide is an example. You can get it at Telligent. Click on the resources when you go on there. You can get all of these, and it can actually bring them into, of course, we're not having, in your communities, you're not having large group meetings usually, right? That's kind of suspended, but you can do some. You can hand it to them and look at any problem with the 5 whys. So why did this happen? Typically, the answer to the first why makes you go to another why. why. Drills down by asking why. So that's the 5 whys worksheet. You can get it on Intelligent if you wanted a worksheet. So let's look at this example here. So the problem is woke up late. Well, why did you wake up late? Because the alarm did not go off. Why didn't the alarm go off? Because the time reset on the clock. Well, why did the time reset on the clock? Because the power went out. Great, right? Why did power go out? Because there was a storm. You're gonna go, well, why was there a storm? I don't know. I don't know. So then you're gonna look and say, you're gonna go, well, this root cause is not in my control. Okay, it's not in my control, right? Can't control the storms. So let's look at another example here too. 5 whys of the same problem, woke up late. Why did you wake up late? Because the alarm did not go off. Why didn't the alarm go off? Because the time reset on the clock. Why did the time reset? Because the clock lost power. Why did the clock lose power? Because backup battery was not installed. Why was the backup battery not installed? Because I didn't know I needed to install one. Okay. Well, that one's, you can remedy that one. So this root cause is within your control. So you'll know, go out and get a battery and put it in your clock, and then you won't be late. You won't wake up late, right? So that is an example of what is in your control. When you're looking at root causes, only select those root causes that are in your control, because if they're in your control, you can make a difference on it. You can't change the storm, but you can change battery. Okay, this is, again, we're going to focus on the process of root cause and not the people. I think we talked about that. Again, you're not going to be pointing fingers. You're not going to be blaming. We're not playing the blame game here. Yeah. Explore the cause and effect underlying the process. Start with the data. Data are facts. It's not an opinion. Well, I think Mr. Gutierrez fell on the floor because, well, you want to make sure you're stating facts. You saw them fall. You're going to go through all of the steps for that. And it helps us find the right solution rather than a global one-size-fits-all. And I just want to be sure and let me remind you again that each of your communities are your culture. You have a culture of leadership and your staff. You have a culture of your residents. You have a culture of what's going on in your home. And only you know your home better than anyone else. So then you'll be able to get down to what intervention may work for your home, may not work for your home. So you're going to find what fits. You're going to get your staff buy-in. So back to RCA, this is a fishbone diagram. You probably can't see it too well over in it, but it's just an example here. This actually is a downloadable tool that you can use. For the homes that I work with, specifically, they are targeted referrals from CMS for a citation or a deficiency in NHSN. And part of the process is for them to go through and do a root cause analysis using the fishbone model. Most people at first aren't used to doing that. We don't know what we're doing. It takes a while to get through and state the problem, looking at the root causes. Once you do that operation or the tool, rehearsal, and working on it, then it becomes second nature to you. So this looks just like a fish diagram. I mean, a fish bone, a fish skeleton. We're in anatomy class here right now for this moment. And the problem statement is going to be at the head of the fish bone. And you can see the head here. This is problem statement. And then each of the spines, branches going out from the spine are going to be categories. And maybe that you don't have to fill in all these sections here. Maybe you only fill in 2 categories. The names of the categories are not set in stone. Of course, we're going to have an example for you. This is an example that we used as part of our targeted referral QII, the Reducing Infection Collaborative. that I work with, a 4-week session. And it's a rolling session. And it is, the problem statement is that antibiotic stewardship on the wrong slide, that's okay, is not functioning per policy. Unnecessary antibiotic use is at 35%. Right? So the main categories that we listed here are education, tracking, leadership, and accountability. So we're going to pause for a moment and talk about how to create a strong aim statement, because you do have to make a goal statement, SMART goal statement with what you're planning to do. So after you've looked at the root causes, you've seen what you're going to do. So now what do you guys want to do with your team? So we're going to develop it. Whenever you create an aim statement, make sure it's easy to remember, not something that's real elaborate. It also ties you to the outcome measure that you want to achieve, and also will include, well, what? You're going to ask these questions. What will it improve? How much? And when? And the quote here from Dr. Berwick again is, some is not a number, soon is not a time. Well, so let's say you've got your goal date. You're not going to say, we want to improve some of the residents' hand washing skills. Well, you know, how are you going to measure some? Same as soon is not a time. Well, we want to do it soon. No, you need to be real specific. We're going to talk about that. So here we go again, the aim statement based on the example fishbone of antibiotic stewardship, right? So antibiotic stewardship is not effective. Unnecessary antibiotic use is at 35%. The aim statement, practically perfect nursing home will decrease unnecessary antibiotic use from 35% to 15% by October 30th, 2020. And you won't be able to probably read all the different root causes that they have there, but we're going to pick one here. So you see the aim statement names who's going to do it. Well, practically perfect nursing home. There's not a nursing home called Perfect Nursing Home, by the way. So what are they going to do? They're going to reduce unnecessary antibiotics use. From what? How do you know they're going to reduce it? Well, 35% down to 15%. And they have a due date, October 30th of 2020. If they don't reach that deadline and they only reduce it to 20%, it's still a win, right? So then they'll continue it, or they'll look and see what else they might need to do, okay? And how do we know? We're going to select one root cause to work up. Now we're not going to, you got to address all the root causes there. Like staff re-education on policy is one. Lacking annual training, it's not documented, there's not a policy and procedure, so there's lots of different root causes. All of those need to be addressed. But right now, we're going to work on one at a time so that you know if you're making a difference. So keep it small and keep it doable and try not to get overwhelmed. We all know we want to achieve it right now. We want it all done now and we want it perfect now. We can't get that way. So this one, we're choosing just one root cause. How do we choose a root cause? We're going to prioritize it based on what your goal is or what your problem statement is. And for the purposes of this example here, it's lacking audits to provide feedback about antibiotic use. We're going to talk more about that. So they selected that. They're now going to put it into a plan. Excuse me. And so now they have, what is their change strategy? So what is their intervention that they're going to do to use to see if that improves? Here, the root cause is named as the lacking audits to provide feedback about antibiotic use. And then the change strategy to test, add an alert in the electronic health record. Most homes have electronic health records for medications, and hopefully yours does too. But if you can still add an alert or something else in your community if you're rural and you don't have the opportunity to have that. So that pops up when an antibiotic is being prescribed, and it requires the prescriber to check for the appropriateness of writing an order for an antibiotic. Does the diagnosis warrant an antibiotic? If yes, that they do, then check for the correct medication, the dose time, route, duration, antibiotic allergies, etc. That's an intervention. They're going to test it. And now we will move into, okay, Z, we're going to take a break, a 15-minute break. So I can stop recording here too. So let's stop here. We'll start into PDSA and then QAPA. Okay. Now, if you say, no, wait, I don't want a break, we'll continue. But no, I'm going to take a break. Questions? All right. So then I have a note. I can stop recording. And then we'll see you back at maybe about 5 till.
This conference will now be recorded.
Okay. Hi, welcome back, everybody. Talking about online courses and things in the, it's really great to have peers, isn't it, to share this information. All right. Again, now we're gonna move into another tool, another process. It's called PDSA, Plan, Do, Study, Act. I've been kind of leading up to that, sharing about that. First, you're going to do the root cause analysis, find out what the issues are. Now you're going to, it actually also leads into a PIP, Performance Improvement Project. And we'll talk about that when I get into the next section here. So Plan, Do, Study, Act, also known as PDSA. That is actually a scientific method for action-oriented learning. So we call it a rapid cycle learning. You want it to be rapid. You want to take that intervention of electronic health record pop-ups with a prescriber wants to prescribe an antibiotic, and then you don't want it to last forever. You don't want that to be a 2-year project. You want it to be within 30 days or 60 days. So in this case, they started in September, wanted to have it by October 30th. If you remember, I'm going back to the example that I had on the root cause analysis. So first on the Plan, Do, Study, Act, you will plan it. So you're going to sit down as your team and plan what you're going to do. Then you're going to try it, activate it, right? Just like an intervention, let's get that going. Then you're going to see how it went. You're going to observe what the results were. And then you're going to act. You're going to take action on what the results were. And also, you're going to document each step. So, that did not. The pause may have been too long. Quick. Hi, guys. I'm going to do a quick PDSA here. See what works. And Z's on the phone. Wow. Stop. Okay. So I need to get this going. What did he do? Take it out, plug it back in. Hang on, guys. Well, it works with the keyboard. So I might just pull the keyboard over just in case the clicker didn't work. Okay, I'm going to use this 4-step PDSA process, right? So here shows you're going to plan on who, what, when, where, and how to do the test of change interventions. Then you're going to do what you planned, just like I said. This is a nice format here listed like in this 4-step. Study your data from doing your plan and then act on what you found out from the data. And then why? Now it's working. Excellent. Why do a PDSA cycle? Why would we want to do it? First of all, you want to believe that your change is going to make a difference. You want to believe, you want that You want to, that this intervention that you all talked about is going to make a difference. Obviously, you're not going to choose a change or intervention that's far-fetched and won't make a difference. You're also going to identify how much improvement you can get and can be expected from the change. And then we can always be improving. So there's times you think of a new way to do something. So even if you've got this going, you may, in the middle of it, decide, wait, we can do something else with this. You're going to decide whether your proposed intervention or your change is going to work in the actual environment. And then you're going to minimize resistance upon implementation. So again, that goes into staff buy-in. You want to get it going. So 4, this is the actual PDSA cycle, what it looks like. You see it's a circle. It starts in the top right with plan. It's the first step. So I've got all these steps like a flow chart. Plan what you're going to do and ask, what are we trying to accomplish? That's the thinking part here. Still in the thinking part is the plan and the do. And then you're going to say, how will we know that a change is an improvement? It's still part of it. And change we make will make a result in the improvement. And that's going to go into the doing part. Then you'll study, and then you will act. So you will see this plan, do, study, act. It's from the IHI, or Institute for Healthcare Improvement. That I was talking about Dr. Don Berwick when that quote about change. And he is also a part of this. So you will see this, and if you may even want to subscribe to IHI, because they have a lot of great tools and resources. And the references, this is in the back of your handout, or your slide, sorry, there's no handout. PDSA cycle here, so up in the plan part, you see how the test or observation will occur. You're going to ask these questions. You're going to decide who's going to perform the tasks. And you're also going to decide how are you going to collect your data. Where are you going to get it from? And we're going to spend a lot of time talking about data, and then predict what you want to happen. So let's say that the electronic health record pops up. You want to predict that prescribers will be made more aware, and they may reduce their prescribing practices if it's unnecessary. Obviously, antibiotics are important and they are necessary, but not in all cases. And then also do test on a small scale. What that means is you don't want to start your test starting small. You don't want to start your test even though you want to. You really don't start your test on the whole entire home. That's pretty monumental. So a really great place to start is on a shift. Choose a shift, or choose one hallway or one neighborhood, or whatever you call your little areas where the residents are. Choose there and start there and set your time frame on it, okay? Then if that's successful, then you can expand it. You can expand it out to the next area of your home, or expand it to another shift, maybe. It's also for a short time period. You want to see those results, see what's going on. For study, you're going to analyze all the data that you have, look at it and see what's up. That's going to give you some information. Remember, data tells a story. Then you're going to examine all the results that you get from your data, what's going on. Compare your actual outcome to the prediction. Did it make it? Did the number of antibiotics reduce? If it didn't, you're going to go back to the act section, which is adopt. You'll either, if it worked, it was successful for that electronic health record pop-up, you're going to keep it. Like, hey, that works, so let's keep it. It's been successful. We'll talk to the prescribers. It may need to be adapted, perhaps. Maybe there's other ideas from the prescriber. Adapt it and make another change, and maybe run another PDSA cycle. Or you're going to abandon that intervention. You're just going to throw it out. However, we want you to know that if you do keep track of all of your interventions, document them, whether they work or not, so that it's there as a historical record of interventions of what works and what doesn't work, so that anyone who comes in and wants to try different methods, if the same problem happens, they can look at that and see what worked. This is a PDSA template. Again, we do have that on television. You could go on the site there and download it. It has sections. So it starts out with the goal setting. And then it goes into plan and do and study and act. I will have an example here for you. Again, what do you want to accomplish? You're going to start with your outcome goal, the quality of care to be improved. You want to use a SMART goal. I'm just going to move on down to that lower section. If you've heard of a SMART goal before, that is an acronym. It stands for specific, so it states exactly what and who and when. It also is measurable. It's something that you can measure, something you can get a piece of data from, you know, like the electronic health record. How many times did the alert pop up? Well, tracking each time gives you that data, so it's measurable. Is it likely to be attained? That's the A part. Is it achievable? Something that's not far-fetched and something you can actually have control over. And also, is it realistic? Is it relevant? Does it align with your values and long-term objectives? And is it time-bound? Does it have a realistic end date that's reasonable? So how do you know if a change is an improvement? You're going to use quantitative measures. Again, that's just a brief thing. We're not going to go launch into it. Quantitative just means it's a quantity. Those are numbers. The number of times the alerts popped up. That's going to be a quantity. Qualitative is is data that is, it's a sensory, it's seen, or maybe it's word of mouth. For instance, there was another nursing home who was working on cleaning blood glucose monitors. They had a citation for that, a deficiency. And so they had ramped up getting wipes, and training their staff, and cleaning it. And what they noticed was, as a qualitative measure part, was the staff and the residents were saying, boy, everything looks so much cleaner. So that counts as some data, just an observation statement. That's and then also the administrator noticed that they were ordering more wipes, more sanitizing wipes more frequently, and that they're really being used to clean the equipment that are shared between residents. And another item that was noticed was that they were taking out the trash more frequently. They were throwing away all these wipes because they're cleaning so much, and the trash is being taken out more frequently. So that's another way of measuring your data in a different way. So again, be specific, avoid some, that word, some improvement or about. You need to set those limits on whenever you set up increase or decrease. Be sure you state specifically what it is you want to increase or decrease. Maybe you want to increase hand hygiene compliance among staff, but you want to decrease UTI rates. We don't want high rates. So it just depends on what you're working on. Study your data. The process includes analyzing your data to measure your performance, looking at it closely as a team if you can. Grab somebody and involve them as well. Examine your results. Use visuals such as graphs. We'll talk about how you can do that. Well, I'll just talk about it right now, because you can actually develop a graph of your data to show your trend. You can use a run chart. A trend graph shows your trends. If you don't have sophisticated software that runs that data for you, the analytics, you can actually go on a Word document. Word has a feature that you can develop, make your own. Also, Excel spreadsheet also has a feature that you can use and develop your own graphs. So even if you don't have analytics, you can do it yourself. I'm going to show you really cool examples from homes in some of the collaborative sessions that I'm working. All right, so now you're going to act again, and we talked about adopting, adapting, and abandoning those interventions, what works, what doesn't work. Here's ideas and sources to get interventions from. It talks about even using online resources, such as webinars. Right now, everything's kind of webinar oriented. And, I used to be boots on the ground going into nursing homes, and now I'm not. Boots on the ground, although I get to come out with you all. So I'm really excited. This is my first time to come out to be with a group of people in this kind of arena. So awesome. And by the way, I've also worked with Z in the past. We've done several classes for him as part of the curriculum. So it's real exciting. But you'll want to use conferences when we get a chance to go back out and go to them. Some conferences are online, resources, change packages, all their, just a multitude of different intervention ideas. And I hate to give you too much information, but you can go onto the Intelligent Connect. There is a fantastic infection prevention and control resource book, and it's called The Guide to Infection Prevention and Control Preparedness. And it is several pages. It's like a clearinghouse of different links, but also it also gives you ideas and change and interventions for certain processes too. So we really don't want to just tell you what to do. We love CMS because they're necessary, but sometimes they tell you what you need to do, and you're left to try to figure it out on your own. And I don't like that. So that's one of the things, roles that we do is provide that technical assistance and to share with you what we know, and y'all share among yourselves. It's just spread the word. We want things to get better, right? QAPI, quality assurance, performance improvement. Y'all have heard it. If you're out there at your computer, raise your hand if you have heard of QAPI. I'm sure all the hands are raising. You all here, maybe you have or haven't. It is required by CMS. You have to do an annual assessment, QAPI assessment, annually. Thing that's been pushed aside because of COVID. So, okay, we need to activate on this problem at hand. Let's get the PPE, please. Let's get, these masks. We need all of these things. But it is important. We're going to integrate, show you how QAPI is necessary. You're going to get a citation if you don't have them now. State surveys coming in and doing full surveys. So you just go back, make sure you have your facility assessment completed, your emergency plan. Make sure you have your QAPI assessment completed, looking for your gaps, if there's any gaps, and make sure that infection prevention and control assessment is completed as well. That's an annual also. And that is something they're focusing on now. And so be sure that you've got that in place so that you can look at it. It's a source of data. That is a data source right there, that assessment. So you look at it and go, okay, this is giving data here. We're weak on this function, on this task here. We have to check no on that. We didn't complete it. Go back and complete it, etc. So, all right. Quality assurance, performance improvement. In the old days, it was just quality assurance, QA or QAA. And that's how CMS started it. Now, since about 2010, the Affordable Care Act included the PI portion of it, which is performance improvement. So it's not just quality assurance anymore. It's like, what are you doing to improve your performance, to make an improvement in the quality of life of your residents, right? That's what we've been talking about. So QA, just quality standards are met. Okay, so you meet the quality standards for QA only. The thresholds meet your regulations. You're meeting those standards, check off. It's a reactive way to respond to a failed standard. Okay, it's like, oh, we got to take action. And then the efforts end once your standard is met. You go, okay, we're done. When you add the PI, the performance improvement, makes the quality even better. Right? The action to fix the problems. You want to improve your processes. It's proactive. You're planning to prevent. It is continuous. You don't stop when the standard is met. You're going to continue it and look back, maybe working on another topic, but you're not going to forget about hand hygiene if you've met 100% compliance. It's still ongoing, right? And then it also talks about a performance improvement project. So now we'll talk about QAPI here. Sorry. Data-driven, proactive approach, just said that. It involves all members of the levels of your organization, everyone. Okay, so when you have, we'll talk about the steering committee or the coffee committee. Some homes haven't instituted that again. It's been a while. Have any of your homes started having, of course, you can't meet in a committee room anymore, but you can do some kind of modification. So just know that you have to do that. The infection prevention nurse is supposed to be attending all of these now. We'll get an F tag, an F882 tag for those infection preventionists. That person has its own tag. So just be sure you have an infection preventionist. Make sure they've gone through that training. And the CDC online training is a great resource. It's got those free modules. I took it. I survived. And so you just want to address those gaps. And so it also is going to make you survey ready. So they're going to walk in, your whole staff are going to know what to do. They know where the books are. They know where the policies are. They know where your QAPI book is. You know, get people knowing where things are. And I won't go into reading all the 5 elements, but these are the components of QAPI. It's going to start, they have element of design and scope, leadership and governance. They're going to have feedback, performance improvement projects. We'll talk about that as well. And then systematic analysis. What are you going to do with all your action? Now we're going to spend quite a bit of time talking about how data drives improvement. But before I do that, I'm going to share what's coming down the pike in the next time we have together, which is wonderful here. We are going to the QAPI program. Now we're going into what the program is. You've heard that term. Now we're going to copy it, is what some people say. What that might mean is that they're going to pivot. They're going to get a plan going, like a PDSA cycle. So you're going to begin by reviewing all of your data. It starts with data. It's like a Casper report. And then you're going to form your QAPI steering committee. That's where you're going to have your medical director. Hopefully they can come. Some medical directors are very, very active and involved. Others are not so involved. It is required by CMS that they are a part of the committee. That is not our responsibility to tell them. It's their responsibility, of course, to know the CMS regulations. But they'll be there, or however you all work it out. Encourage them to come, invite them, always tell them. Then develop your charter. Charter is going to be what the committee focus, what is going to happen during that meeting, like an agenda in a way. And then you'll form a PIP team, performance improvement team. You're going to initiate huddles. We're going to talk about huddles too, and then how to sustain all that good success you get. You're going to focus and latch onto that. So the study phase, again, our performance measurement shows if your program is achieving the results, how the program achieved the results, and why the program did or did not have the desired impact. You're going to look at that from your data. Now we're moving into the data sources. This is an example here of an incident report. It's actually an internal resource that you get. You can get and use that as data. Incident reports, resident reports, your MDS reports. And so that MDS coordinator has a humongous job of knowing all the rules and just being on top of when they have to assess skilled and long stay and 30 days, and all of these different things they have to do, and then to know that. So they're a huge asset. They need to be a part of your team. Auditing tools, Excel spreadsheets, behavior tracking sheets, even data. Can you think of any other sources of data that you may draw from? Maybe. No, I've shared a whole lot here, but just think of that. Go out there, go, oh yeah, that's data too. And yeah, we could use that. Write it down, document it. So don't forget it. Oklahoma has that pay for performance, fortunately. Isn't that great? It kind of was on hold for a little bit. Now it's back on those 4 specific quality measures. So can someone shout out what a quality measure is or pay for performance? Have you heard of pay for performance?
You're reimbursed based on them.
Yes, you are reimbursed based on them in the standard and what they monitor it over a period of time. So good, thank you. And then what are the clinical measures that that they look at? There are 4 of them. And yes, we have-
UTI, weight loss, antipsychotics.
And then one more. What? Pressure ulcer, that also. That was actually got better. Oklahoma had better rates in pressure ulcer rates over the past few years, and now it's coming back up. There's a resurgence of it, somebody said. And UTIs at one time, Oklahoma led the nation being the worst rated for UTIs. I don't know the current standing on that. I know it's still not good. So yes, so that's good. You want to start working on that. Get some money, get some reimbursement. There's another data source here. This is the 5-star rating preview. And you can see that CMS has that guide online. Tells you a little bit what the criteria are. Casper facility level. This one is the facility level quality measure report. And it tells it tells what's going on in your community, right? And so it lists the clinical measures. Clinical measures mean like UTI, pressure ulcers, those things that are clinical for a resident that would be. It has changed since I started. It changed in January to now it looks like this. It starts with the high risk, and those green arrows are there just to point out where the clinical measures are. Are you all familiar with the Casper report? Some communities are not. They're not using them. COVID got in the way. You need to pull, that is your major source of data. I don't know, I can't stress that enough. That is your most very, very valuable source of information about how your home is performing. That's how your home is performing, is showing you what's going on. So I encourage you to run the report monthly. And it's a 6-month rolling period. So for example, if you wanted to run, I always start with January. So you could start with January 1st, let's say 2020, and run through July 31st. That report would be through July 31st of 2020. And you ran it during that specific time frame. It's going to capture that 6-month period. You would get that report in August. I'm kind of going back a little bit. In August, and that's what you're going to see. So usually the report drops about a week. See if I can word this in a way that, so if you wanted your data for July, for instance, is July 31st, you move into August. It'll take the CMS system about sometimes a week to roll it out where you see your July data from that period of time. Makes sense. So usually about the 7th or 10th of each month, you can pull the report from the previous month. Now it's not real time. And some homes have software that gives you real time, like within 24-hour period of time. But the Casper report is here to stay for a while. And you need to show. I tell you what, when survey walks on site, they're going to have that Casper report in hand. They're going to say, here you are, you're in here, your UTIs are here, your weight loss is here, you're doing here, and I notice it hasn't improved in the last 6 months. So you need to get that back out. So dust off your Casper reports, start pulling them again. A lot of times it's just the MDS coordinator, sometimes the administrator likes to pull them, or run them is what I mean, the same thing. Run the report and print them out. Bring those Casper to your QAPI meetings and let your staff know what's going on, okay? I won't go into how to read it, that's another session. Highlighting all the red, then another report is the resident level quality measure report. This one is like the secret sauce to the whole thing here. It's like, okay, we're on UTI rate is 12%, which is an astronomical rate, sorry, just saying that. So why, there's that why question. Why is it 12%? Who is involved in group? Who triggered for UTI? What resident shows up as having a UTI? So the resident level report is also something to run monthly, and it states the names of the residents. You may have seen it in all this lengthwise here, like the yellow section here. That's all psychoactive meds. That's one is listed there. Tells you all of them. And if on this illustration here, there are red check marks, that means that resident triggered for that particular incident or that particular measure. Something else you need to know is that some residents are no longer there at your community, and they're still going to show up on your report. So you have to factor that into your percentages too, unfortunately. Also, the next one, just a quick, this is a run graph of getting that data. This one is a home that plugged in some data for PPE donning from the audits. And they actually had a start date of March 15th, and they made some interventions in it March 15th, where that yellow line is going acted vertically. Then that's where the interventions took place, and you started to see some improvement. You see the lines above the 80%, which was the median, is improving. They did the interventions there. This one I think I really wanted to share with you too. This is a home in our last collaborative for targeted referral from CMS. Part of it was bringing in their plan and setting an example PDSA. This one's filled out. It is an example of a real one. On the problem statement, they said the hand washing compliance was poor, right? I think it was at non-compliance among staff on the second floor, 40% during meal tray delivery. So that 40%, that's kind of huge. It's not good. During specific meal tray deliveries, they wanted to improve that. And they had their goal of improving hand hygiene among staff to 100% by October 30th. The intervention they used was to have, excuse me, signs on meal trays to remind about hand hygiene, and the responsible people to monitor that were the ADON and the DON, and then how were they going to be monitored and tracked? Hand hygiene will be observed using auditing tools. Okay, that's what it says, what they're going to do. Say what they're going to do. Is that achievable? Can you audit with it, or is that something you can't achieve? Definitely achievable. What I mean is compared to something that's far-fetched. It's relatable to the problem statement. They're going to observe using different auditing tools. They use ghost audits. Ghost audits are invisible audits where you don't know, like right now, I'm auditing all of you. No, I'm not. Where you don't know you're being audited. So then the next one, they took this information and they graphed it. They graphed it for 5 weeks. They're still in process of doing this. And you see that week 1 with the interventions, and they taught the staff, they shared what they were going to do, of course. And it started out, the baseline they started out was only an 87% compliance. So week 1, and I don't have a pointer, or there's probably one here, but I don't know how to use it. So it's the yellow line, and it says 94% on that graph. All right, well, that's an improvement from 87, right? So that's like, we're going to celebrate that win. Week 2, you see that it went to 92%. So there's a dip in it. There was not an improvement that week. Is that okay? It's going to happen. It's going to happen. And so we got to accept what's going on. And so that at this point now, you can look at that data. It's telling a story. Something happened. You'll go back and think, okay, what happened? Was there staff turnover? Did they take vacation? What was going on? And you see they ramped up it, went back on week 3, went back up to 94%. So they're back where they started at week 1. And now look at week 4. It's like some magic happened. Not magic, of course, but an intervention that really tracked it and improved it. And then week 5 went to 90% during the audit. So, this is just, it's going to vary. And you have to have constant vigilance on this. This is a real example. This is an Excel spreadsheet that they used, or this slide, this example. And so they use it to track their data, to demonstrate and illustrate, and they could bring that to their staff and say, look, guys, what happened here? You know, they could call a huddle. They could talk about it in team meeting in the morning or however your community does that. So found this out too from another home in that same learning collaborative in August. Prioritizing a small change makes a big difference. So if you take a small population to work on like one unit, one hallway, you know, and you start there and you're tracking it, you're measuring it, then it can make a huge difference in their process. This is what Holly Heights Nursing Center said, and they're from Denver, because we do work with Oklahoma homes. I'm an Oklahoman. Oklahoma, Iowa, Illinois, and Colorado. And I said, hey, Janet, can I use your, you've got Holly Heights on the slide. She goes, yeah. So anyway, that was her takeaway from doing the PDSA and the cycle. So QAPI committee, when you get your QAPI team together, they're going to be, administrators are going to be department heads, someone from each environmental service, someone from dietary, infection prevention nurse has to be a part of it as well. Of course, sometimes they're not there, you know, or sometimes you're on vacation, sometimes there's other reasons. Sometimes we're at trainings like with Intelligent. They can't come. So I have that team. I don't know if you can do it remotely. I don't know what you guys are doing. Is anyone doing a QAPI committee? And if so, how are you doing it? How is it taking place? Yeah, and that's okay. It's kind of like we're building back up to QAPI. Don't forget about it. Letting everybody know it'll happen. All right.
The one we had last week, it was face to face. We had a quality prevention nurse was there, and the department heads were also present.
You were there.
So there was a plan of correction.
Right.
That led to that.
So for those of you who are in remote land there, Edward was sharing that they did have a face-to-face little QAPI meeting. You may hear QAPI. I like to say QAPI meeting where they were getting it going, and that infection preventionist was there as well. Yeah, sharing, because right now that's the focus, right? It is. Everything's a focus, and it's kind of on the front lines. So what does a charter do? It's like a plan. Charter is a plan. And so it's going to describe your quality improvement goals, what the interventions are, who's going to participate in it. So someone probably took notes at your QAPI, and they should. You need to document them so that when state survey arrives, and the federal surveyors can come on site too. I worked with a home in the northern part of Oklahoma, and they had just had the federal surveyors on site. So that can happen at any time too. You know, it's good. It keeps us, you know, we learn from those surveys. So it's not all bad. It's intimidating. It's scary. It makes your heart stop and your blood pressure rise. But when you've got things in place, you can grab your books and they said, what about this? Or they interview your staff, or they interview your residents, you know. They can say, oh, they've got great leadership here. They get their team involved, you know, so they can tell all these things. But the charter or the QAPI notes that you take, keep them. And then make sure someone knows where they are. So someone can go back and say, oh, yes. So if your administrator's gone and state surveys on site, then someone else can share that information, right? So don't keep that information secret. Go ahead and tell somebody. And we know that you all are super busy. We really do. But get that charter out where it identifies your goals. There's more information here. This is an actual copy. It's not an actual copy. It's a slide of a copy of a team charter. And you'll also hear committee meetings. You can hear different language for the QAPI. This would be for monthly. CMS still requires it quarterly. Some homes like to do it monthly. They can get that CASPER data, see what's going on with the COVID assessment tool, see if they've improved their infection prevention assessment and met their different gaps. So questions so far? I mean, there's a ton of information. It's like, anybody, you've got the slides, you've got references, you know, I'm going to share again how to contact me, how to contact Sherry. We're the Oklahoma girls from Intelligent. We're the ones who work with the homes here in Oklahoma. So what is a steering committee? And a steering committee are those who are going to be, they're the committee meetings. You hear probably in politics or civil meetings like county clerks' offices, or I don't know, you hear about the steering committees. And it's really the committees who are going to kind of steer where you're going with the quality improvement. It's also just the committee team members, okay? And again, I shared you do have to meet QAPI quarterly. These meetings, it's again, some are striving to monthly. We anticipate that CMS will require in time to be monthly meetings, but they're not, it's not required right now. All right, and that's where you're going to also consult with your pharmacy consultant. You're going to get the people, key people, department heads. So you've got your housekeeping, you have your, your environmental services, dietary, your maintenance crew, the facility director, whoever on board. If you're a corporate and you're owned by corporate, and just when you're sending out the emails, letting them know, send them an email as well. Oftentimes the corporate do not attend, but they know that way it lets them know that you are doing what you're supposed to be doing, right? So it's like, okay, what else do I need to do? Oh, I need to let the corporate, or if you, like Beaver County Nursing Home is owned by the hospital. So they let the board members there know. And then Town of Viceside is a municipality, so they're owned by the city. And so they let those city key people know that they're going to have a meeting. So they can come. And then the next thing you want to do is deploy a PIP team. That's a performance improvement project team. All right, so how are you going to do that? You're going to get about 5 people, 3 or 4, depending on the size of your home. You're going to get the people who are, so let's say you're working on electronic health record, or you're working on UTIs. You want to reduce the number of urinary tract infections. And so you get a PIP team together, and that's the topic. Get UTI, here's what the rate is, write down the percentage rate, what it is for September, let's say, or for October. And then write down that. That's going to be your baseline number. What intervention are you going to do? Start with 1. The big one will be start with MDS coordinator. And unfortunately, we're not pointing fingers at the coordinator. But occasionally there could be an error. Or if you have a new MDS coordinator, then they may not know. There's a lot to know. I don't know if any of y'all have any awareness of what the MDS coordinator does. There might be aware. So start there, might not be aware. Start there, then you're going to look at all the other. Let's try this intervention. Let's try improving hand hygiene and peri-care with the new, whatever you want to do. Try that intervention. That PIP team's going to come back and report out at the committee, WAPI steering committee meeting. Okay, they're going to be, okay, we're working on UTI and this is what we're doing. And then they will get feedback from the QAPI committee. That's how the PIP team works. And it goes hand in hand with the PDSA cycle, right? So if your intervention doesn't work, you abandon it. But you've got your documentation tool. So you can be developing that as we speak. So again, a PIP team is focusing on a specific topic, a particular problem, a concern or an issue. And the charter is going to define the PIP's mission. Well, the mission would be what they're going to do. And it's data driven, right? You're going to look at data. That's how you're going to, that's your measurement for knowing, for improvement. It's goal driven. You want to achieve, maybe you set a rate from 12% UTI, and you want to go down to make it achievable, make it 9%. Of course, you want to go to 0%. That is unrealistic. It's not going to happen in 60 days, right? It really isn't, unless there's some cleanup that's going on with your MDS or something, right? And it's also team driven. got that solid, strong team you guys are working on. Your team is solid and strong. The PIP team is going to work on developing the interventions. And when it takes what they have in their plan to the QAPI committee, they also share and provide input in the interventions and what they're going to look at. Is there improvement? That's going to be telling them. If there's not improvement, what do you do if there's no improvement? I'm asking you all. You all. So let's say a PIP team says, hey, there's no improvement in our UTI right here. What happened with this intervention?
You may leave it and explore another means.
Right. Get rid of it. Leave it. And then you're going to look at something else. You brainstorm, you get back, you do that huddle, and you get back together. So PIP teams requirements, they have to meet once a month. And that CMS requirement, they have to meet at least once a month. Some meet twice a month, depending on what they're working on. It also is a separate meeting from the QAPI meeting. It's not the same. However, it's hard enough getting people together, right? So your QAPI steering committee doesn't have to last an hour. It can be 20 minutes. And maybe the PIP team has their little meeting 10 minutes after that. After the full meeting, you're kind of already there. You don't have to go for hours and hours. Set it, where you're going to get people, where you can pull people to come over and see if you can get coverage while the people are in the meetings there. All right. So I was working with Chandler Nursing Home, and they said I could share this. I always like to ask permission. I gave a little in-service on QAPI, and then I'm asking them questions about it this is a stellar comment. A PIP is a small team working on a problem to make the home better. Now that was a CNA, can't sum that up any better than that. And it's just exciting when, that's what it is really all about, is to getting everybody involved. Huddles, and we're moving on to huddles here. Y'all need a little water, drink, or a stretch. Stand up and stretch. No? Keep rolling with the huddle is a quick meeting, 15 minutes tops. Okay, we're talking, it's not an hour meeting. That's a meeting. Huddle is a quick thing. Now you can schedule it. Like, I don't know, some people have morning huddles in the morning, or some people call them something else in the morning. I forget some of the names that are real clever. Their morning meetings. Some people don't even have time anymore for a morning meeting. They hit the ground running when they come in, and they, going through their temperature check and making sure they've got their PPE supplies, making sure that they're doing all of what they're supposed to be doing. So sometimes huddles are out the wayside. We're trying to encourage you. So if that's the case, have a huddle at another time of the day. You can have it as shift change. You can have it, and then anytime there's an event, meaning if there's something going on in your home, something happened, or you're going to have a new admission suddenly, and you need to huddle with key people, you call a huddle, and you say, this is what we're going to do. We need to do this. What can we do? Got to get this going. Who's going to take it? You're already doing that, but you're not calling it a huddle, maybe. Let's say something happened in dietary and you need to call a quick huddle. It could be 2 or 3 minutes. It could be like that football field. Coach, the huddle with the team. It's not a long huddle. When they have a huddle, that's what? A minute, 2, 3, something like that. So then they get that, they pull it together. It's like, okay, I'm refocused now. Let's go. And so you can use a huddle anytime for any reason, and do use it. It does communicate. It does communicate with your team. It also lets them know, again, that they're important. Maybe you just huddle. And also, huddles also, if one of your staff members are doing hand hygiene incorrectly, for instance, and you don't want to have a public display of doing this wrong, It doesn't do much for staff morale. You want to re-educate them or something. So if you pull together 2 or 3 people and make it more of a huddle instead of a, I can't think of the word, a verbal okay, I'm sorry, I'm at a loss of words, but I think you know what I mean. You're not trying to out the staff person. You're trying to encourage them to say, hey, what went wrong? And then go from there. So you can use a huddle. Quality improvement project, use a huddle. This slide shows some examples. Follow up on issues, update news from new departments. Maybe they're getting a new supervisor in environmental services, and you want to bring it all in. Keep it constructive. These are just rules, again, about teams and how to relate to people. Even if you're swamped and you're like so stressed and distracted, keep it constructive, and it takes practice. It really does take practice. And forget name. Don't do the blame game. Try to make it as constructive and as meaningful as possible. That's what huddles are really for. So tips for success on a huddle again. These are for longer huddles. Have an agenda. Use the current data during the huddle. Of course, you wouldn't use old data. You're going to use the current data. Be constructive, right? And keep it positive. Keep that positive flow to help improve, your morale. Y'all are working hard. You're working hard. And we appreciate it. But you can accomplish so much even through that. And it just like you're learning so much about all the rules, regulations, all the deficiencies, all the monetary penalties, everything else. But in the middle of that, QAPI, PIP, your teams, you're valuing your teams is really the root. It's really like the backbone of how to help prevent your deficiencies. Am I right? I mean, it is. I'm telling you it's right. Okay. So also, let's do this. Here's just a to-do list. I won't read through all of them there. The PIP to-do list should have the following again. Leadership support, the clear purpose, why you're there, what your plan is. You may need to conduct the RCA, root cause analysis. Follow up within a week or so. Use huddles, share. Some homes actually get creative and create if they had a whiteboard or I'm losing another word, cork board or something they can tell the entire nursing home community they're working on falls. And some people make creative names for that. And then they show interventions and show, some people are real savvy and creative and can pull together sparkles and all kinds of fun things and make it really creative and share with all the staff. So you're going to share with the staff. It makes it a little more fun, something else to do. And then, so again, I'm going to tell you that. Whoops. Here is a beautiful quote from Maya Angelou. You may have seen this. There's many renditions or many adaptations. I did then what I knew how to do. Now that I know better, I do better. Right? You know better. You don't have to keep doing the same thing. All right, sustainability. Here. We're winding down, folks. So I'm going to expect lots of questions from you. Not through, didn't say that, but we are. Sustainability and quality improvement. How are you going to keep your good practices going? How are you going to keep those interventions that are working? How are you going to keep it going? So there's some ways you can do that. You don't have to have the answer today, but there's some ways to do it. If you don't already know, we do have, I'll get to that in just a minute, a sustainability guide. But what is sustainability? It means to sustain, to keep. If you play the piano, there is I don't know if there's any pianists out there, but there's a sustain pedal on your piano so that if you want to play on the keyboard and you want to have a note linger, then you press the sustain and it holds it longer, so it keeps it going, right? So that's just an example there. Now you all want to go and get a piano, don't you? Sustainability, where, new ways of working, improved outcomes become the norm. They're part of your workflow. They're hardwired in your team. It's like, we're going to keep this. You're going to document it and keep track of it. Don't forget what worked. In the hustle bustle of everything, have paper and pencil or pen or whatever available at all times. Jot down those notes. I don't know if you do that. If it's sticky note, I'm a sticky note person. Put them in your pocket, write down a note. Do something that helps you remember to keep an idea going, because I'll forget if I don't. I don't know about you, maybe you've got a superhero brain, but for memory, do whatever it takes to keep those ideas going, right? So want to make sure, again, it's mainstream among your staff that they're doing it as part of their workflow, that's part of their muscle memory. So even when state survey comes on board, we're still talking about sustainability here. State survey comes in and your CNA is doing the task properly, has done it, they're stellar, they're like a champion CNA, they're a mentor to other CNAs who are new. Sometimes, when the state survey walks in, there's nothing like knowing they're there and then feeling like, oh my gosh, they're watching me, and then they can make an error because they're upset. It's human nature. It can happen. Practicing and sustaining it and where it becomes hardwired in their system can help overcome that, knowing you're being audited. Like, hey, you got this. You're going to be fine. So, again, especially at this time of COVID-19, it's almost like a curse word now, isn't it? Like, okay, but it's here. It's going to be here for a little longer. We don't know how long. Hand hygiene is so critical, so you want to make sure they have those processes. We should have been washing our hands to begin with, forever and ever. I mean, surgeons used to perform surgery without gloves, dirty stuff, and they go from patient to patient before they knew all about the stuff with hand hygiene, and there's all this science behind it. Florence Nightingale helped with that. I'll just say that. Kudos to another nurse who did some hand hygiene practices. So, okay, so enough about that. But hand hygiene, so that your staff know that the hand hygiene processes is like forefront in their mind. It just is part of their routine. Go in, the hand washing, visit your resident, hand hygiene again, and you go back. It's a part of it. Tips for sustaining your improvements. You want to make it standard. First of all, you want all the job descriptions to be clear so your staff know what to do, first of all, and that they need to go ahead and follow these steps, these sequences of hand hygiene, right? Accountability and documentation, get the standards, policies and procedures written, make sure you review them, bring them out again, maybe have a team member review them too and see if there's something else you can add. If you make a revision, write a date on it so that it shows that you've looked at it. Visual management system, that would be like a graph or other visual that you want to develop. Let staff know how they're doing. And then again, the huddles, multiple times a day is a communication system. Gotta have that. Problem solving techniques, right? We talked about that this morning. Root cause analysis. Got a problem? Write it down. If you saw any of the videos, I've got a homework for you. Okay, so it's listed at the back of the PowerPoint. Don't go there now, but it'll tell you about PDSA. Did any of you see the PDSA homework? I don't know about you out there. If you didn't, please find time to see it. It's about a real life situation. It's a mom trying to get her kids out the door to school on time. They're always tardy. So it shows the PDSA cycle and how you can use it in your own real life scenario, your own real life. Some people use it to go to track, to take a trip, or you can use it You got a problem at home, do a root cause. You do it in your head anyway. Okay, the tire's flat. Well, why? You know, you have to change it. Maybe it's a nail, maybe they can patch it, maybe you have to replace it. So anyway, those are all good problem-solving techniques and skills. Sustaining initiatives, a QI initiative, that's a quality improvement initiative. And that's what Sherry talked about. It's an initiative, it's like a project in a way. CMS calls it an initiative so that every Friday, CMS will drop, well, we say drop, a list of homes that maybe are hotspot homes in a hotspot community, excuse me, in any of the 4 states that we work with, for us to work. And part of, they do a root cause analysis, they do the PDSA, I showed you an example of both of them. And then we do a QI initiative, which is what part of what I do as well. It's a 4-week collaborative. Sherry talked about the collaborative part, which is in your printout that you print out. If you print it out, you don't have to. I think mine is the only, if you're going to print out a session, then be sure to print out mine, okay? Just kidding. So an initiative, again, is just a project. And so in this initiative, the 4 weeks, they take their plan that they developed, what they need to improve. Maybe it's based on an FTAG or, you know, a directed plan of correction. And they bring it to the table with their teams. And it's all remote, of course. They're not remote, but I am. In the whole group is, to develop a PDSA cycle. And so for the first week, you do the plan. The second week, you do the do, then take it out. And then you're going to study the results and show them how to graph. You can do some simple math calculations too. Like, okay, you're going to audit 5 staff on hand hygiene. How many were compliant? How many were not? And there's a simple math calculation you can do with that. If you want that information, you email me and I'll send it to you too. It's pretty cool. You can get percentage rates without having a heavy duty, expensive analytic system in your computer. All right. This is the QAPI sustainability guide. It's from CMS. It is also downloadable. There's also the link, and we do have that in the reference. And it does is a checklist that tells you how to checklist to do sustainability. Be sure that, well, one of the questions in it is, can the change be integrated into employee orientation and training? And that's, you know, the onboarding. When you get new staff, and you need to do all that training with them, and then retraining and re-education. So there's the sustainability guide does have some great information that's already done. I mean, the questions are already formulated for you. It's just a great, checklists are great. I don't know about you, but, you know, check. It's certainly fine if you want to do that. All right, we're now into an activity, and you guys are going to have to think. I'm not going to think for you anymore. So none of you all here did any of the homework review, because I know it's homework, but did anyone look at it? No, you don't have to. In fact, I'm glad you didn't, okay, because that makes it even better. Okay, we're going to do an activity. We're going to take some time. What we want you to do, and it's a team building and a communication skill. It's actually an activity you can take with you to your teams and do it. So I'm going to get out some supplies. But you don't have to use peanut butter and jelly. I'm actually allergic to peanuts, so I can't have peanut butter. But you don't have to have grape jelly. But you can use whatever you want. So I'm going to pull out stuff that a lot of people use to make PJs. Right? Has anyone here ever had a peanut butter and jelly sandwich? Right? Yeah. Okay. I mean, I think kids have that for breakfast. Sometimes that was something else they did. Okay. I kind of have over here. going to keep this. Y'all have pens, right? So pull out a pen or a pencil. And I hope you guys out there are going to see, I'm going to try to make this a visible activity so that you can see it, or at least get the gist of what I'm doing here. Like this. And I'm going to get this out in just a minute. So it starts, you guys can have, this is a tabletop chart, and you can get that anywhere. You know, you probably don't want to eat the PBJ on the table. I don't know. I'm just getting out a couple of things that people do. I have a knife. I have something to clean up with so that Z doesn't have to clean up. I've got jelly, and I've got peanut butter and bread. So I need to move this actually back over here. Okay. So here we have, right? Are y'all wondering what we're doing here? Isn't this exciting? This is so fun. Besides QAPI and QI, this is probably my second favorite part of the whole thing here. Okay, here's bread. And I'm going to leave it like that. Okay, so what I'd like you all to do, you can do it as a team. There's just 5 of you. I'm going to give you, see, because usually you break out into small groups and work as a team, and then we pick a team to do it. I don't want you to get that close to people. So you just kind of turn around to each other. You're all going to work, because this is a group right here of 5. It takes about 5 people. Someone can be actually, who would like to be the secretary or the documenter?
Scribe.
Thank
I have
you.
a terrible penmanship.
And we have Nola raising her hand. I'm going to go, I'll put on my mask. You have terrible, yes, cry. I think I used up all my brain power. I can't think of my words. Okay, so I'm coming over here. Actually, I keep this. So you're going to scribe. If you guys will turn to Nola, y'all are your team. First of all, come up with a team name. We've got time, so this is great. PBJ.
PBJ.
PBJ Club. Great, write it down. Something else you can do too is come up with team names. Like anytime you have a project or something, name the project. Make it fun. Make it something that your home knows. One of the homes I'm working with actually is doing hand hygiene and taking it out to train on some different things, and they're using glitter as part of the hand washing. They're putting, staff have to get glitter on their hands, and then they have to wash all of it off. And so they're also putting some glitter on some surfaces, and they're using their gloves or their hands to touch the surface and see what picks up. And it's supposed to represent germs. So they're calling their project the Sparkling Hands Project. And so it has dual meaning here. It's like a double entendre in a way. It's like sparkling hands because of the glitter, right? And then your hands will be sparkling clean when you wash off the glitter. So kudos. So, all right, PBJ Club. Is that kind of like a breakfast club? All right, I'm going to kind of go over here. Y'all come up with the steps on how to make a PBJ, and then I'm going to make it. Okay. And we'll take, well, you can take 5 or 10 minutes. Come up with, how you would do the sequences based on what today.
Step 1, get out the supplies. Please.
Assemble.
Step. We can make this on step.
So you put it in the car, right? What is the name of the car?
Yeah, bring it. Yeah, that's the goal, is to make a peanut butter and jelly. So better supplies, we probably need to tell somebody what those supplies are. would use like a utensil for spreading. You know, kind of make it, maybe someone who's never had a table. Don't know these.
2 spreading utensils, plate or napkin or whatever. Grape and gin.
Nut butter, you're okay with that? And you said jam or jelly? Jam or jelly? Would recommend grape.
Strawberry percent.
Symbol.
Yes, that bread. The bread. Cut the bread into old fashioned.
So just get, so we'll just say just get 2 slices.
Yeah, desired amount of slices.
Okay.
You need to take the lids off of the peanut butter and jelly.
Yeah. Put some steps out.
Start with peanut butter, jelly.
Peanut butter first.
That helps you know your jelly ratio.
That's right. What I usually do.
Yeah.
Yeah. I use the same knife, so it's easier to wipe off the jelly than it is the peanut butter.
That is true.
How about I can just add it all together? Right amount of jelly and jam or peanut butter on.
Mixture of peanut butter. Some people mix it together. Some people buy it mixed together. I don't like it like that. I tried it, make it mixed together. It's not as good.
Just next step, like put our amounts in our bread.
Bread is our
So we tell them to put
close.
together,
Close bread, enjoy.
together and jelly.
I don't know if you want to get it or not.
And, oh yeah, we could do like optional slice.
Try and slice it, cut off the crust.
Right, yeah, oh, that's good, yeah, slice. Oh, and then we could even say, you could add in things. Some people put butter,
Honey.
honey, sprinkles. Add-ons. Chocolate syrup. No, I definitely think we need a cleanup step, just last step. After you enjoyed it, put everything away.
How many steps is that?
Come on, 8.
We could have really made step 1 like wash your hands.
Wash your hands.
Or decide if you want the sandwich to begin with.
This is for you. Consider allergies. So I just went with simple supplies. Get a desired amount of bread. Take off the lids of jars. Spread. And then put together. Enjoy. And we have an optional.
Add condiments.
And then put everything away and clean.
Like a knife. Or you think.
Y'all have agreement?
We have a plan.
Got a plan, agreement? All right, cool. I'm gonna bring this over. And what I did, and I'll just set it here, and I'm gonna turn it around so that those people out there in remote land out there, we wish you were here so you could do this too. Maybe someday we'll all be together again. You can get a flip chart or something. I put the name of the group, their little club, PBJ Club is what they're gonna do, what they have here. So what they're gonna do first of all is, I'm gonna write the steps. Actually, do you mind to number them? And that way, I'll just number these sticky notes. See, I'm improvising too, doing it this way instead of with the full group. So go ahead and number the steps, and then I'm gonna number the sticky tabs. So, okay, so read out what you have.
8 steps.
Okay,
And the first one is assemble the supplies.
okay.
Next one I'm gonna do.
Okay. She says assemble supplies. That's, okay. I'm gonna put it over here. Thank you. Okay, and what's next? Okay,
Get desired amount of bread.
get desired amount of bread. So normally you would have little sticky notes. That's why I'm using part of your step here. Bread. Out. Okay, and then what's next?
Take off the lids, jars.
Okay, and then next.
Spread desired amount of peanut butter and jelly. Then we have put them together. This is enjoy.
Okay. All right, so what I'm going to show you guys here, and this is really for all your benefit here. Normally you would be in a group, you'd have your own, y'all would write the steps down on a sticky note. You could tear off the sheet of a sticky kind of a pad, like this is a self-stick, post it, you could post it on the wall or the board. And then each team would have, they'd assemble, they discuss it, whatever they wanted to do together. And then you would tell me how to make the sandwich, okay? So I just put it here as a demo. It's kind of a revised edition here. I'm gonna have you read the steps to me, please. So who will read for me? I'm gonna make it.
Okay, assemble supplies,
Okay,
get the bread out. Desired amount of bread.
okay,
We'll take lids off jars.
take lids off jars.
Spread desired amount of PB&J on bread. Okay. Missed a step.
Well, and something else. Okay.
Okay.
So, okay, if you guys out there could see, the instructions for me were to assemble supplies, take the bread out. Well, I did. I took the bread out. I mean, right? And then, or that was my interpretation. Uh-oh, Z's gonna want me to clean. Take off the lids of the jars. Spread desired amount of peanut butter on the bread. I did. And put them together. I didn't,
Throw them together.
okay. And enjoy. All right.
Nothing.
So you see, so what was missing?
Moving from the package.
Sure, sure. So you can see that getting all the steps together, being super clear and specific, to do that. One time when Greg said, open the bread, well, you rip it open, because, so anyway, I think you all get the idea.
Yeah.
It is a fun thing to do with your teams too, to have a team building exercise, get it and say, hey, this is a communication where anyone can look at your steps and know what to do. Right? Well, okay, point taken. Good job, guys. Yeah, round of applause. Okay, so I'm going to move this over here. Any questions? Anybody from the remote people? Okay. No questions? This is a lot of material, a lot of content. And I went through it quickly, I think. Tell me your thoughts. What did you think about the content? I mean, what did you think about? Do you feel like you're more knowledgeable? Tell me some thoughts here.
I have a question. Is that copy, is that done at, I know it's nursing homes, long-term care, but is that also at like residential care facilities, assisted living? Is that across the board?
It is required for long-term care. I know the rules and regulations for long-term. I don't know about the others. However, you can see, I don't, for assisted living, those are different environments. And for your ICDF population as well.
Yeah, I know it's not required on the ICF. I didn't know about residential care.
Don't know. And if anyone out there knows if it's required in those other arenas, it is required for long-term care. That was the focus of what we're doing here. But if you want to adapt any of these things, maybe you have a problem, do a root cause analysis, pull out the 5 whys and see, what's going on. So these are still useful to do. Get your team members who may be in charge or who you want to be involved with some decision making as part of the committee. So adapt it. And all of these things, you adapt it to the culture of your home and what your needs are. Okay, that's the cool thing about this. Yes, things are standard. Yes, they're requirements. Yes, you have to do them, but you can adapt it and make it useful for you. As far as making it for a pandemic is an infection that spreads, of course, across the entire globe. And that's where we are here. Of course, with COVID, the way this relates, I think you can see that there's infection preventionist is a requirement on your home, at least part-time. It doesn't say what part-time, 1 day a week, 1 hour a week. We don't know, but they're extremely necessary now. Some homes have an infection preventionist full-time. Some do not, can't hire someone full-time. And it doesn't have to be the infection preventionist who's doing all the training and the auditing. The entire home should be knowing all these things. So get other people on board to help you with your training and with your knowledge. Spread the wealth. Yes, you're an administrator, or you will be. And yes, you're making a lot of financial decisions, all these things you have to do. So get help. Enlist people to support you with other, I've seen administrators want to do it all. And I've seen administrators hand off too. So, I mean, you feel what's comfortable, you do what's comfortable, you know your team, and you utilize them. And there are some, look, and I've got a resource here for you, the State Operations Manual, CMS, State Operations Manual. Have you heard that term? If you haven't, you need to go ahead and download it. I think it's about 700, maybe 1,000 pages. You don't have to print it. And the reason I say, well, you can print it if you want, but there are changes all the time. At least every 6 months, they add change or modify. So they update you with the notifications of their changes on the state operations manual. So have it downloaded or have it accessible, or just have the link accessible, and then bookmark where you want to look. So say you want to look at infection prevention, bookmark where you are. I think it starts at like page 600 and something. And then you go on down. The F880 is the surveyor's comments about the infection prevention problem. F882 is the infection preventionist. They get their own special tag if you don't have one, or if they haven't gone through training. Some homes require multiple staff to go through training, take those 23 modules. It's a good thing to know. All right. Questions, comments about that? The state operations manuals in our resource. Here's what we did today, guys, for this morning. Almost 3 hours worth, Shared Intelligent Quinn QIO. That's what Sherry talked about. She talked about a lot of things. That the QIOs for all the states, like Intelligent again has 4 states: Oklahoma, Iowa, Illinois, and Colorado for the nursing home board. Identify quality improvement methods and tools. Describe importance of teamwork for successful improvement processes. Define components of the QAPI processes. And then explain how the QAPI program is really programmed to help improvement during a pandemic. And if you look at an objective, or if you look at the objectives here, you see that all of them start with a verb, an action word, right? Describe, identify, define, explain. And that's how you're going to do your flowcharts too, just like that. So I point that out to you, just like home. Questions, y'all out there? Any questions for you or for me? Any questions from you for me? You can always email, call. Here's the little homework here. I really want y'all to explore it. Be sure you check out the PDSA, the Domestic Lean Goddess. That's actually Production Intelligence several years ago. One of our medical directors' voices on there. Getting the kids to school on time. There's a YouTube link to it there. It's not broken. I checked it out. It's working. And the peanut butter and jelly demo. And this is, again, communicating specific instructions, but it's pretty hilarious. Not like what we did here. And that is also YouTube. It's not broken. It's still intact. It's still working. I have 2 sections of resources, 2 slides of resources here, teeny tiny print, but it does have on there where you can find the QAPI self-assessment tool. And then Intelligent has a fillable QAPI self-assessment tool. That just means that you can go fill it in yourself, print it off. If you have that capability and functionality of your computer, there's QAPI at a glance. There's the CDC infection preventionist training site. It's free. Did I say that? It is free. And I took it, so, and I'm still standing. CMS State Operations Manual. Need to know those regulations. So it has a variety of what pharmacist, medical director, every single aspect of what you all need to know. Then we also have a do-it-yourself toolkit you can look at for all kinds of things to improve quality. There is QI and QIO you can sign up on. And it has just, again, that third one down. I want to point that one out, especially the guidebook for infection prevention and control preparedness. That one has several pages. It has like a clearinghouse that gives you ideas and tips for interventions and for process measures. And then it tells you that there's huddle tip sheets, CMS QAPI, the science of improvement. So you can see down the link there. Here's my name and Sherry's name here. Share and contact us. We're here in Oklahoma. We can get back with you if you've got questions. We're serious. If you need something or you can't find a resource or whatever you need, or when you take this information back to your community, like with Edward, when you go back and change your working at yours, is that right? You're at a community as well. So you can share these resources, share this information, PowerPoint, whatever, with them, okay? With your directors and your leaders. Yeah. I want to also tell you guys, especially those at home, or wherever you are remote, to please, I don't have the chat function here. Normally we can type in the chat. We do like to hear from you. You will assess Sherry and I. Give us a shout out how you think we did, because first of all, we use that information as our data for our improvement, okay? So we're into data sources too. And like Sherry said, it's all about data. For you who are here, you'd like to fill out an anonymous one. I mean, well, they're all of them. I can give it to you. We can just put it in here. For you out there, you don't get access to a piece of paper. Oops, I don't have this one. You're good. Fill it out, and if you will just, I'm going to turn this around and have you, well, I can give it to me or leave it right there, and I'll put it. Thanks. Coming over here. Oh, you did? Excellent.
They're all the links work on the slides.
Yes.
That's awesome.
Oh, it does. Perfect. It is
Even if they learn more on the side, you can click it, brings you right to the link.
So even on a PDF version, do you all have the PDF? Well, I think that's pretty cool. I wasn't sure on PDF if it did, so that's cool. So we already have one survey person. Thank you for that piece of data. We appreciate it. You all have an awesome, awesome, safe, healthy day. Thank you. Not gonna peanut butter.